Boom. And we are recording. Very good. Well, we'll get rolling so we can get this done, and anyone that pops up later can just play catch up. HIV and AIDS. I know this is not as endemic a problem as it used to be, but with the Washington state boards, they have a tendency to lag a little behind the time. I would rather see HIV replaced by COVID myself, but this is a requirement for the state that we have to teach a class specifically dedicated to HIV and AIDS. And it is still a problem, but fortunately through better practices and some of the drugs coming out today, most AIDS victims can live a long, healthy life. Or fairly healthy life as long as they stay on their medications. So things have gotten much better for this disease. And in light of current circumstances, I'd much rather see us do some focusing on things like pandemics, but until the state catches up to us. What are we going to talk about? We're going to talk about two things. We're going to talk about HIV and AIDS. They are not the same thing, which we will see as we go through here. A lot of people get that misimpression. HIV is the actual virus, the bug that you get, whereas AIDS are the set of symptoms that you can get as a result of contracting the HIV virus. So I'll explain more about that as we go along. Take a look at this guy, my bug man. Immunity refers to the body's protective response to infection and disease. I beat you up with that. I'll just go through, pass on with that. What is HIV? HIV is a virus, but it is a retrovirus. A lot of viruses get into a cell, they go into the nuclei, they splice into the DNA and turn the cell into a virus producing factory. That's what viruses do. This is a little different. It's a retrovirus, which is what made it so difficult for us in the 80s and 90s to try to find a cure or at least a preventative for it, because we had not dealt with a lot of retroviruses at that time. But the retrovirus uses a splice of RNA to replicate itself. Kind of similar to COVID, if you think about it. It uses that messenger RNA. It was discovered in 1981. If I remember correctly, there was a airplane attendant who had gone to Africa and contracted it, and had gone flying around the world, and various boyfriends had managed to spread the disease. And the problem with HIV is it's very, very, very long incubation period. When you have something like Ebola, when somebody gets Ebola, within a couple of days, they're dying. So it's real easy to stop it because we can find out where it is, isolate it really quickly, and stop anybody from traveling outside that sphere of influence. So the longer the incubation period, the more difficult it is for us to contain a disease or a virus. As you can see with COVID, COVID has a very long incubation period too, at least a couple of weeks, which is what allowed it to spread. Well, the HIV could be years. So it spread very easily before we even was aware that it was even out there. But by 2013, we had 1.2 million cases, and we still get about 40,000 new cases every year. It's still a problem. I don't know how recent that number is, but it gives you a good ballpark. Now, the thing about HIV is it has to be spread through body fluids, and we'll look at the different ways that it's transmitted, but by blood, by semen, by other body fluids getting under the skin, for example, saliva in a wound or something like that might do it. Not usually. Usually it has to be a pretty close intimate contact. A part of the reason for that is this virus does not survive well at room temperature. Once it leaves the body and hits room temperature, loses the heat, it pretty much dies. So it really has to go from body to body, maintaining that temperature. And what it does is it targets the T4 cells or the CD4 cells, are both the same thing. And we remember the T cells, right? We have the B cells and the T cells. Well, basically, it stops your body from manufacturing T cells. And then without the T cells, you have you're immunocompromised. So you really don't die from the HIV virus. You die because you contract a disease and your body can't fight it off. More often than not, it's pneumonia. So, but we'll talk more about that as we go along. There again, the cell becomes a virus factory. That's true of all viruses. Once the virus gets into the nuclei or modifies the nuclei, the cell begins producing viruses. And when it's produced, a crap load of viruses, probably a couple million at least, the cell bursts and the cell dies. And these viruses go out into your body. So it's going around killing cells in your body, which is not healthy at all. There again, HIV is the infection. It's the virus. AIDS is the condition that you develop from HIV. Not all patients will necessarily develop AIDS. You could have somebody running around carrying the virus and their T cells are never compromised. By some fluke of nature, they manage to resist it, but they're still carrying the virus and they can still be spreading it. And that's why it's so important when people have multiple partners that they just make sure they get tested, because I mean, I imagine how bad you would feel if you're sitting here going around and you realize you've spread the virus to 15 other people and you didn't even realize you had it. There again, good argument for safe sex practices. If you don't contain HIV, though, it can progress into AIDS. There's a couple of different types, but the most common type running around the world right today is HIV-1. There's another subtype, HIV-2. Isn't that really nice when they just number them instead of Omicron, Delta, whatever? But HIV-2 is mostly limited to sub-Saharan Africa. So that would be the southern part of Africa. There's my little critter right there. Oh, yes. Might want to remember that too. The slide is available online under the module for this week. So if you want to ever go back and look at it, you can do that. Now, there's 4 basic stages of HIV. This is kind of interesting. When you first get it, you'll get like flu-like symptoms where sore throat, swollen lymph node, just like the flu. This is your body launching an immune response against the virus. But it just kind of comes and it kind of goes, and you're convinced you had the flu. Unless you get tested, you have no way of knowing that it was actually an HIV virus that caused it. And most people think, oh, okay, I caught the flu. I'm okay now. It's all good. Nothing serious happens because you still have a lot of T cells. There's a latent period there, stage 2, where really not a whole lot goes on, but the virus is evolving during that period. And then stage 3, you'll begin to develop the flu-like symptoms again. Now, stage 3 will move on to stage 4, and that's when the viral load becomes high enough that it can attack enough T4 cells to drop your T cells below 200 cells per microliter. Now, your normal is 500 to 1500. So 200, that's an important number to remember. Once you get below 200 T cells or CD4 cells, you are now a candidate to develop any of these infections that will become full-blown AIDS. It's a number you might want to remember. So here it kind of shows the stage 1. Stage 1, where's my, oh, there's my pointer right there. Now, see, this is showing your B cells. So you get the primary infection. Now, that's when you get those flu-like symptoms, and then it goes away. And say, okay, I had the flu. So this is all stage 1 over here. And then you go into the latency period, and this can last, like it shows, for years. It can be 4, 5, 6, 7 years. Meanwhile, that whole time, the virus is slowly chewing away at your T cells. Now, when you get into stage 3, that's when you get below the 200 T cells. And when it drops down here, you basically have no more immune system. You have no way of fighting off opportunistic infections. And that's when you'll contract something like pneumonia, and which could eventually lead to death. I did work in a respiratory unit back when I was going to nursing school. In the 90s, it was right at the height of all this, and we had several HIV patients, and watched at least a couple of them die from the pneumonia, and it's not a pretty sight. It's basically the person can't breathe anymore. It's like slowly drowning, very slowly. How does one contract it? Sex. That's the primary one right there, sexual transmission. That could be between different sexes or between same sexes. They both have the possibility. Now, that being said, usually the sexual fluids have to make contact with the blood. So there has to be a thin enough membrane or something between the sexual fluids and the person's bloodstream in order for the person to contract it. So that is why how to put this tactfully, anal sex can be so dangerous because it often results in tears, which allows access to the bloodstream. Mother to child. If a mother has AIDS, you can't transmit it to the child. Other methods, IV drug use, sharing needles that are dirty, accidental needle sticks, which you have to watch out for being a nurse. Although the incidence of transmission by accidental needle sticks is very low. IV drug use, the one young man I watched die of pneumonia decided he would experiment with an IV drug. First and only time in his life he ever did it. He happened to use a dirty needle and ended up dying at the age of 19 of AIDS. It's really sad. Blood transfusions, not so much anymore. Still a very, 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 very minute possibility. I think when we were doing drug transfusions, we were talking about that. It was like 1 in 1 million, if I remember correctly. Don't hold me to that. Oh, here it is right here. 2 million to 1. If I'd read my slides, I would know what's up there. So the odds of you getting HIV from a blood transfusion is 2 million. You probably stand a better chance of winning the Powerball. IV drug use, though, very good chance of getting it from that. Contracted through blood with the needle stick, sexual fluids, vaginal secretions, and breast milk to the baby. You cannot get it. Now, keep this in mind. You cannot get it from urine, from stools, from vomit, from sweat. And this was a big issue back when I was working in the 90s. People were afraid of HIV. They were afraid to shake hands with people. You know, it's got to be a very, very intimate contact in order for you to contract HIV. You know, so I think we've done enough education now that we don't hesitate to touch these people or give them a hug when they need it. You know, it really has to be direct to blood contact in order for you to contract it. Condom with spermicide is the best prevention as far as sexual transmission goes. Not using IV drugs is another good way not to get it. But if you are going to do IV medications of any kind, you use a complete sterile, clean needle. And that's when they had that big issue with people, we were handing out needles to these people that were IV drug users, so they wouldn't use dirty needles. And there was, as you can imagine, there was a lot of controversy over that. So if we're giving them needles, aren't we encouraging them to use drugs? And I said, not necessarily. But as far as sexual contact, condom with spermicide is the best prevention. You might want to remember that. Testing. There's several different ways of testing for HIV. The most common is called ELISA, I think is what they call it, but immunoassay test. The ELISA is not a real expensive test. So what we will usually do is we will screen the person using the ELISA. If it's negative, then the person does not have HIV. If it's positive, we might have a false positive, so we give the test twice. If both tests come back positive, we move on to the more expensive test, the Western blot test. So remember that. If someone goes in for a test, they're going to get an ELISA. If it's positive, they're going to get a second ELISA. If both are positive, then they get the Western blot test, which is a much more definitive exact test. So if they come back positive on the Western blot, it's a 99.99% chance they are positive for HIV. I put a little note down here. There was a movie called Philadelphia that was made in 1993 with Tom Hanks and Denzel Washington. Very, very good movie. It was done at the height of the AIDS epidemic, and does a really, really good job of portraying what these people have to go through. So tonight on Netflix, you're not bored, look it up. Remember, 2 ELISAs, if they're positive, Western blot. Not that I would ever put that on a test or anything. So what is AIDS then? If HIV is the virus, what's AIDS? AIDS is when an opportunistic infection attacks your body and your body cannot protect itself because your T cells have been wiped out. That is what AIDS is. So somebody who is in the AIDS stage of HIV, their T cells are below 200 and you just can't fight off infections anymore. Pneumocystic pneumonia, I think that's what the PCP stands for, but it's a form of pneumonia. This is the big killer right here. This is the one that usually knocks them out. You also get CMV, which is a herpes virus. Kaposi sarcoma. If you watch the movie Philadelphia, you'll see that there's little spots that appear on the skin. And the worse you get in the AIDS progression, the more of these spots you get. They're like dark, scabby type things on the skin. And those are called Kaposi sarcomas. Those are skin cancers. Your body can't fight off the skin cancers anymore. Candidiasis and vaginal warts for females also show up. There is a table in your book, 35.2 in your TIMBYs, that gives you a list like this long of different opportunistic infections that you can contract. Of course, I don't expect you to know all those. Another thing that is a result of AIDS is dementia complex, ADC, AIDS dementia complex, where you develop dementia type symptoms. And that's because of the infection going into the brain. Forgetfulness, decreased concentration, delusion, staggering. People in the latter part of AIDS will usually start showing some of these symptoms. So ADC, AIDS dementia complex. Here's that chart that I was just telling you about. As you can see, there is a whole slew of different opportunistic diseases that can wipe you out. once you hit that stage. And that's when your T cells are below 200. 200 to 500, here's a couple things that you might contract during that period, like the herpes, the candida, and different stuff like that. This might be a clue to those who are not aware that they have the HIV virus. It may be time to get in there and get tested and make sure. How do we manage it? Prophylactic is the best. There is a test. In fact, I think downtown Seattle, they hand this test out, PrEP test. Okay, now I got to admit, I'm a little confused. There is a medication that we can give to people that helps prevent them from getting HIV. And it kind of escapes me right now what that is, but I'm sure it's mentioned in the book. For those who have contracted HIV and those who they wanted to keep them from going into full-blown AIDS, there are different types of therapy that we can use. ART, antiretroviral therapy. These are drugs that basically fight the virus and try to keep it from attaching to the T cells. For those who are more advanced in HIV, there's the highly active ART, which now here with the antiretroviral therapy, they may use one of these drugs right here. When it gets more advanced, they may use a cocktail of 2 or more. So basically, when you're talking about heart, you're just talking about the ART drugs, but you're using 2 or more of them. It's a combination, it's a cocktail, hopefully with a synergistic effect. Now, the reason for that is the different ART drugs, the different antiretroviral therapy drugs attack the virus in different ways. Now, going back to the HIV virus, reverse transcriptionase is what the HIV virus uses. It uses that enzyme like a Xerox machine to replicate the DNA of the cell and modify it. So if we can interfere with that reverse transcriptionase, then we can stop the effect of the HIV virus. And that's where the NRTI, nucleoside reverse transcriptionase inhibitor, I am not expecting you to memorize that. I certainly am not. But what it does is it mimics the reverse transcriptionase enzyme. And so it blocks, when the HIV produces this enzyme to the cell, this mimics that enzyme and blocks it so that the HIV's reverse transcriptionase enzyme can't attach to the cell. So in other words, we're just blocking it, keeping it from attacking the cell. The NNRTI actually attacks the reverse transcriptionase enzyme itself and messes with it so that it can't attach to the cell as well and replicate. And this is just all for your own information here. I'm not expecting you to know how these drugs work, but I find it interesting. And it kind of makes you wonder, could they have used any of these drugs for COVID? But it's possible that COVID does not use reverse transcriptionase. So, but there are some other vaccines out there that were similar that they're playing with that could not possibly be used against COVID, besides the one that we're currently using from those 2 companies. I forget the name. But this is really interesting. I mean, virology is a fascinating field. A virus is nothing more than a couple pieces of cell, but how they can use such ingenious methodologies for attacking the body is just beyond comprehension. And things we can do to try to subvert their attempts to attack your body. I mean, it's got to be a fascinating field to do research in. Those of you that want to go on to advanced degrees. Yay. Truvada is the med name for PrEP. Now that is And that's to help prevent an individual from getting AIDS, if I'm correct, right? And I think that's the drug they hand out in Seattle pretty much to anybody who wants it, to kind of block you, keep you from contracting AIDS if you are sexually active. Okay, moving on. The important things to remember about this drug treatment: it's lifelong management. You don't take it for a while and stop. You're on it for the rest of your life. It's like immunosuppressant drugs after you've had a transplant. Which, by the way, you hear the guy had a pig's heart put in him that was genetically modified, and he's doing perfectly well. So it'd be possible that we could have heart transplants, lung transplants, kidney transplants from DNA modified pigs, and the body doesn't reject it at all, which means you're not on any immunosuppressant drugs at all and should last the rest of your life. I mean, to me, that is, whoa, that's fantastic. That's exactly what we need. I mean, kind of funny walking around with a pig's heart. I mean, there's all kinds of jokes you can go for that, but I'm sure he's going to have a fun time with that. Nursing management. Like I said, the drugs are lifelong. You're on them for the rest of your life, but you can lead a rather normal life as long as you stay on the medications. Prevention is the number one way to keep from getting it. Don't use dirty needles. Now, if you are going to be on any of these medications, you have to notify your doctor if you are pregnant. Some of these drugs may have an adverse effect on the fetus. I don't know offhand any, but that's something you want to make your doctor aware of. And monitor the patients for reactions to the medications. These are very powerful drugs, very powerful drugs. They do have side effects, so patients have to be aware of that. Mental health. AIDS has a stigma, and when somebody is positive for HIV, it's almost like the old biblical thing where they feel like they have to put a hood over their head and walk down the street and shout unclean, unclean, like the lepers used to have to do in biblical times. Very isolating. There's a lot of discrimination against people with AIDS. It is very hard on the individual. We have to be supportive as we can, try to get them support groups and whatever we can to help them to deal with it, because they can now lead a full life. But I mean, you know, what good is leading a full life if they're going to treat you like you're some kind of disease, you know? Very important to embrace these people, let them know they're a part of the community. Final note, AIDS used to be a death sentence. Back when I first got into nursing in the 1990s, if you came back positive for AIDS, make out your will. 6 to 18 months. Now, the funny thing about it is you could contract the AIDS and live a normal life for like 5 or 6 or 7 years until you reach stage 3. And then once you hit stage 3, you got like 6 months and you're gone. But because of the antiretroviral drugs, today you can live a full life. So that's the good news. Any questions on all that? Kind of blasted through it. How are we doing for time? Whoa, that's the shortest class I think I've taught yet. But I think I pretty much covered everything we need to. Any questions on that before I stop the recording?